The concept of the mutant selection window is that a drug concentration range exists where resistant bacterial mutants are selected most frequently. The mutant selection window is best described as follows. It is the range of antibiotic concentration that lies in between the minimum inhibitory concentration, or MIC, and the level at which all bacteria are inhibited and no mutants are then produced, called the mutant prevention concentration, or MPC. Ultimately, the mutant prevention concentration is the minimum inhibitory concentration of the least susceptible single-step mutant, meaning that all bacteria are then eradicated and no mutants are produced. The goal is to achieve, at the disease target site, an applied dose that is safe and adequately exceeds both the MIC and MPC in order to eradicate the bacteria, including any potentially emerging mutant strains. There must also be negligible systemic exposure so that no ecologic mischief occurs systemically at other sites remote from the site of application within the body, such as the GI tract, genitourinary tract, such as the vaginal canal, the oropharynx, or the nasopharynx. For treatment of a skin disease, the above may be easier to achieve with a topical antibiotic agent, but harder with a systemic agent. Levels below the MIC are known to avoid antibiotic selection pressure and usually incorporate modes of action other than antibiotic activity to produce efficacy. You can see evidence of this in experiments with sub-MIC doses of doxycycline in acne. After 6 months of treatment, there was reduction in the number of comedones, in the number of inflammatory lesions, and in the number of non-inflammatory lesions, but there was no statistically significant differences in normal skin flora or antibiotic susceptibility between or within the treatment groups and placebo groups from baseline. As an example of what happens with drug doses above the mutant prevention concentration, we could look at over-the-counter topical antifungals, as shown. Since these are widely used in the treatment of fungal vaginosis, you might think that azole resistance among vaginal yeast isolates would be very high. However, we have observed the opposite. The reason for that probably has something to do with the fact that the mutant prevention concentration for Candida albicans and Candida glabrata is about 10 to 20 milligrams per liter. Since the topical antifungals are usually 1% formulations, or 10 milligrams per milliliter, the local drug concentration would be more than 500 times the mutant prevention concentration, which would account for the lack of resistance to these products. The selection of an appropriate dose depends upon, among other things, the relationship between the mutant selection window and the therapeutic window of an antibiotic. The therapeutic window is the dosing window between the lowest effective dose and the highest tolerable dose. In many cases, prescribed doses are inside the mutant selection window and apply selection pressure when they are administered. For the most part, resistance in an individual patient is held in check by the rationale of high fitness cost, as explained above, and by the host immune system, which clears pathogens after they are exposed to antibiotics. Over hundreds of millions of antibiotic prescriptions, however, even small numbers of resistant mutant pathogens become important, as over time they continually increase in number and distribution. Topical formulations may be advantageous when considering selection for resistance because they can allow for delivering concentrations above the mutant prevention concentration on the skin, but with very low systemic exposure. Since well-formulated topical agents typically provide favorable skin tolerability and usually preclude systemic toxicity, they can be dosed much higher than with oral administration. Obviously, this is going to depend on which antibiotic we are considering. If we had a topical antibiotic that could deliver concentrations higher than the mutant prevention concentration at the site of infection, but at the same time with less systemic exposure than the minimum inhibitory concentration, we may avoid the selection of resistant mutant bacteria. As topical agents may be best suited to deliver doses outside of the mutant selection window, they have the potential to be an effective approach to impeding bacterial resistance if we can find the right formulation, concentration, and recommended dosing. Thank you for taking the time to listen to this presentation. I hope this sheds some light on your understanding of antibiotic resistance in dermatology.